Today we will discuss about the blood pressure. What is blood pressure? First is try to understand what is blood pressure. Have you ever seen a pipe, plastic pipe, which is not filled with fluid? It lies in a collapsed state. ऐसे पिचकी हुई होती है. Once you push water into it, or you can say attach it to a motor, the water starts flowing into this pipe and it distends. And if there is some leakage, water gushes out from that leak also. What does it mean? That the flowing water in the tube is generating pressure against the wall of the tube. Right? Similar is the system in our body. The heart pumps blood into the arteries, and this is exhibited in the form of blood pressure. What we record is blood pressure, and the instrument we use is called simple BP apparatus or sphygmomanometer. You can note down the spelling also. So it is of two types. Blood pressure can be, one is systolic and diastolic. Systolic is that which is exerted, the force exerted by the blood against the walls of the blood vessels during the systole. Systole, what is systole? When the heart is contracted. And diastole is when the heart is resting. That is when in between the two contractions. At that time also blood is present in the arteries and it still exerts force against the vessel wall, right? So now what is the normal blood pressure? We call it as 120 systolic and 80 diastolic, right? So if it is 120 to 130 systolic, then we will call it as pre-hypertension, diastolic 80 to 90. Sometimes कई दफ़ा आप पेशेंट आए, वो जी थोड़ा सा ही है, इतना तो हो ही जाता है. That is not correct. That means it is a pre-hypertensive state and the person will slowly land into the hypertensive state. The measures need to be taken when still the blood pressure is in the pre-hypertensive state. Later on it is hypertension, right? Now, what are the parts of the blood pressure apparatus? We will see it practically also. One is the inflatable one, which you press and generate the pressure in the inflatable cuff. Second is the mercury strip. Third, tubing, mercury chamber. These days, as you might be aware or might not be aware, the mercury has been banned and no longer mercury blood pressures are available. So it is the LED BP apparatus or Android BP apparatus or the automatic blood pressure apparatus. These are the three types you can note down. One is the LED blood pressure apparatus, non-mercury. Second is the Android, and third is the automatic. So first you try to understand the mechanism behind recording of blood pressure apparatus, blood pressure. What happens? You apply the cuff around the arm and start raising the pressure in the cuff, right? So what will happen? The pressure builds up around the arm of the patient. So a point comes when pressure reaches the pressure, systolic pressure, the pressure which is being exerted by the contracting heart against the walls. सर जब उससे भी प्रेशर आप आर्म में बढ़ा देते हो, देन व्हाट हैपन, फॉर ए मोमेंट द ब्लड सप्लाई इनटू दैट पार्ट स्टॉप्स। तो आर्म में जो आगे सप्लाई जानी है ब्लड की वो नहीं जाएगी, बिकॉज यू हैव रेज द प्रेशर इन द कफ to such a degree that it is higher than the contracting heart. Is it clear? Now what will happen? Then you will slowly release the pressure from the inflated cuff. Inflated cuff से slowly आप release करो pressure. Then a point will come when it will match the contracting pressure, heart contracting pressure, and a sound will appear that blood has started moving into the distal extremity, which previously was stopped due to a high pressure in the cuff. Is it clear? Yes. So at that time what you hear is the Korsakoff sound. This is a word. उसमें तब आपको क्या सुनती है? Korsakoff sound सुनती है. So that you will take as a first reading, that is the systolic blood pressure. Now how to record the diastolic? You will further lower the blood pressure slowly in the inflated cuff. Then a point will come when this sound which you are hearing previously will stop. So at that point where the sound disappear, that is your diastolic blood pressure, right? So today we will see some of the parts of the so you should again sterilize your hands, and you will also need the stethoscope, so you can hear the blood pressure either with this is the bell of the stethoscope and this is the diaphragm. Usually people use diaphragm, but bell can also be used. It gives a better conduction of sound, right? So this is the lock of the BP apparatus. Let me show you. This is the mercury free. It is mercury free BP apparatus, LED, right? So these types of BP apparatuses, they are available. Mercury are not available, right? You will open this lock from here. This is how you will see it. This is the pressure gauge, and this is the cuff which will be inflated, and this is the inflating, and this is the tube, right? So this cuff, it has to be applied on the upper arm. These tubing, they should be in the front. They should not be laterally or behind. They should always be in the front, right? And you have to apply it on the upper arm in a snuggly manner. What does this mean? As if you are wearing the slacks, which is not very tight, not very loose. Just it should be in contact with the upper arm with no space in between, and it should not be very tight also, that it hurts the patient. Then you will lock it with this, or sometimes there is another mechanism. You will lock it and then start inflating. You have to make it on from here. This will, now the mechanism is on. These are the batteries here, and as you will inflate it, this will start rising, right? So this is all about, we will do the demo practically on some of your volunteers with all the three BP presses, Android, LED and automatic, right? Next time. Okay, thank you.